will. We know that focal therapy, particularly using HIFU and cryotherapy, are increasingly used in recent years, and the outcomes for this have previously been reported up to 7 years post-focal therapy. We've seen Deepika's paper being cited in the previous presentations. The aim of this study, with a bit more follow-up now, is to report 10-year outcomes from the UK. So we looked at the UK heat and ice prospectively maintained registries for patients who either went focal HIFU or cryotherapy respectively. And we defined the focal intervention as including up to 2 focal ablative sessions. The primary outcome was cancer-specific mortality, and we also looked at all-cause mortality, metastasis, the need for local retreatment, radical treatment, and ADT use. Now, for the local retreatment and radical treatment, we did 2 sets of analyses. The first were intention to treat analyses, we termed, and these were any occurrence of the endpoint. And the second were per protocol analyses. And these were instances of radical treatment where we decided the patient potentially could have undergone further focal therapy instead. So in those analyses, patients were censored at the time of radical treatment if they didn't meet any of these indications, which were grade group 4 to 5 cancer on a rebiopsy, grade group 2 to 3 cancer with simultaneous in and out of field recurrence, grade group 2 to 3 cancer with at least 1 previous redo focal ablation session, or at least 2 previous redo focal ablation sessions. So we included 3,471 patients from 14 centres in the UK, the majority of which underwent HIFU. And we can see that there was a diverse case mix with a very low proportion of patients with EAU low-risk disease. As the primary outcome, our cancer-specific mortality over 10 years was 0.1%, with 2 deaths due to cancer. All-cause mortality was 12% over the 10 years. Metastasis, 3%. Local retreatment, 32% on an intention to treat basis. On a per protocol basis, 11%. Radical treatment on an intention to treat basis was 30%, and on a per protocol basis was 9%. And last, ADT use was 13.6% over the 10 years. So in conclusion, in this large multi-centered cohort with a high representation of intermediate, unfavorable, and high-risk disease, we found focal therapy using HIFU and cryotherapy to have promising cancer control over the long term. And we believe our data supports focal therapy as a first-line treatment alongside other radical treatments for well-selected cases of localized disease. Thank you.